everybody. This is Eric Peacock, co-founder and CEO of MyHealthTeams. Today, we're talking with Dr. Siddharth Tambar of the Chicago Arthritis and Regenerative Medicine organization. Dr. Tambar is kind enough to talk to us a little bit about rheumatological conditions like lupus and spondylitis and rheumatoid arthritis, and particularly in light of all that's going on with COVID-19. Dr. Tambar, welcome.
Thank you very much, Eric. I appreciate it. I appreciate the invite. I appreciate talking about these things. I know everyone has a ton of questions and concerns, and I think some sensible talk goes a long way.
Right on. I guess the first question, we have a lot of members who have lupus, RA, spondylitis, other rheumatological conditions. And the first question they often ask is, by having this condition, does it raise my risk of contracting COVID-19 or for experiencing more serious complications?
Yeah, great question. So, the first thing is, we live in a really interesting era where there's so much information, traditional media, social media, and sometimes it can be overwhelming. But one of the advantages right now is that in something that's brand new, it's so helpful that we're able to get information from other physicians around the world. And a lot of it is very informal right now. There are organizations that are trying to collect that information in a more formal way at this point in terms of what's happening with our autoimmune rheumatologic patients. But informally, what we're hearing is that there is not a higher risk of getting infected in our patient population with autoimmune issues than, let's say, the general population. Now, our patients do have some other exceptional issues, which I'm sure we'll talk about, that need to be noted and considered and all that. But as a at baseline, our patients are not considered higher risk until you start kind of throwing in some of the other variables.
What are some of those other variables?
Yeah, absolutely. So number one, if there's an autoimmune condition that's really severely active, where you're talking someone that has dramatically active inflammation, that throws off the autoimmune system, or that throws off your immune system in general. If somebody has a condition like lupus, where they actually have other organ involvement, certainly that can make them more susceptible and high risk as well. And then certainly medications have to be talked about in a sensible way as well. So if we're talking about patients that have a stable condition that is under control on meds, they are at likely higher risk for contracting any kind of illness, any kind of infectious disease. But from the standpoint of having worse outcomes, if a condition is under control, we think that their risk is really the same as the general population.
Got it. Okay, let me unpack that just for a second. Yeah. Let's say you have lupus and it's progressed to lupus nephritis. Yeah. So you've got kidney issues. Does that change the picture somewhat?
Oh yeah, of course, right? I mean, if you have an active medical condition that is affecting any kind of significant vital organ, definitely you're at higher risk, right? So the nature of these conversations when it comes to autoimmune patients is that a lot of it is very individualized and specific to what's going on with that exact person. And so in lupus, you've got like a huge range of things that can happen. And so if you take someone that has kidney issues that are active, definitely that's a higher risk person for sure. But that's because the risk is coming from not just having the label of lupus, but rather because of what organs are involved and what else is going on with that person.
So if you have, when you talk about these other kind of critical conditions, if you have things like heart or lung disease or diabetes or diabetic nephropathy or so, issues with the kidney or dialysis, those all might be kind of additional factors like this.
Absolutely. I mean, the nature of any sort of chronic active condition is that it makes you more susceptible to any other kind of infectious issue. If those conditions are under control, if they're on the mild end, then that's a different story. But things that are really more moderate to severely active definitely complicates things. And that's, some of the things that I'm hearing about medication short supply and things like that really implicates those folks who are in that higher risk pool where they have active disease.
Right. Okay. Just on the shortage, obviously the question on many people with lupus's mind is Plaquenil. Is there any risk of shortage of supply of that as people think that it's something
Yeah.
to...
I mean, realistically, you're talking, it's interesting because I've had this conversation in like multiple different levels and layers with people recently. And Plaquenil is a really mild medication. It's not immunosuppressive. It does slightly modulate the immune system. It's a great option for mild lupus, sometimes RA. And so it has a role in a small subset of our patients, and it works really well in those patients. Worldwide, it's not like there are a massive number of people taking Plaquenil. But when you now suddenly have the kind of publicity that's out there about a potential use for this in something else, and you have 8 billion people whose eyeballs are on that, obviously there's starting to be some concerns about short supply. What I'm hearing from patients, what I'm hearing from pharmacies is that either they're not being given a full prescription, let's say a full 90 days, maybe they're only getting 30 days, in some cases only 20 days, or they're being told, hey, we just don't have the medication on hand, you're gonna have to wait. It's challenging because we know that the meds are being bought up for possible use in COVID-19 and likely being bought up for people who are thinking about using it preventatively, where there's really limited evidence of that. And so it's challenging because we have a legitimate reason for it in a subset of our autoimmune patients. And definitely I am starting to hear that there is some limitation in supply.
Okay, thank you for telling us that. Just to also clarify the previous point, let's say I have spondylitis or rheumatoid arthritis. I'm taking, I don't know, Humira or Cimzia or some therapy for it, and my symptoms are relatively under control. Are you telling those patients something different than you're telling the patient who maybe is in really active flare?
Yeah, I mean, so number one, that person who has a controlled condition, again, what we're hearing from around the world from physicians is that continue taking the meds. All right, that's number one. Number two are specialty societies, which were kind of late to kind of speaking up on this, but have in the last couple of days, are saying, whether that's American College of Rheumatology, there's an American Dermatology Association, they are recommending continuing taking the meds if you're on like a stable dosage. So you have to always think about risk and benefit. The reality is, even before COVID-19, just being on those kind of meds puts people at slightly higher risk for infection. And in the setting of COVID-19, it's the same thing. So thinking about and balancing risks and benefits, while there's a little bit higher risk being on the medication, the benefits are that your immune system is under control. And rather than having a ragingly active condition, which on its own puts you at higher risk for infections, but puts you at risk for other types of organ kind of damage. And if it ends up leading you to start taking prednisone, anti-inflammatory meds, like there's other risks that you're then layering on. Steroids in particular, if you're taking a high dose for a prolonged period of time, that puts you at risk for dramatically higher risk for infections than just the meds that we're using routinely for these autoimmune conditions. Also keep in mind that for folks who are taking steroids at a high enough dosage, that too also ends up putting them at higher risk for things like diabetes, high blood pressure, other types of organ problems, adrenal insufficiency, you can throw off your thyroid, like all those things are connected with the immune system as well. So, this is, like, from a medical standpoint, as a physician, the way I think of it is we're always trying to thread the needle with our patients. Like we're trying to walk a very tight tightrope here, right? And it's a balancing act that is possible where you try to get a medication that is adequately effective, but not too aggressive where it's causing damage. And if you can walk that middle finally, then people do well. And this is really the same thing, meaning I understand that people have a heightened sense of concern about this right now, which is appropriate, but understand that the medical thinking is really the same thing. You're walking that tightrope, and as long as you're managed in a proper and safe way, you'll be okay. Obviously, take all the public health sort of considerations about social distancing, hand washing, coughing, all the basics. Take that appropriately, but you're still walking that tightrope. And if you're working with, a physician who's able to guide you in that kind of balance, you'll be okay.
So if you're on a immunomodulator or a TNF inhibitor or an IL inhibitor or something like that, if that's allowing you to keep your symptoms in check and not be on a corticosteroid or something, the benefits of that probably, obviously it depends each patient to patient, but outweigh the potential risks of being higher beta infection. So just take care of yourself, wash your hands, all that kind of stuff.
Absolutely. But again, the other important thing is what we're hearing from the rest of the world is our patients, while we always say like our patients are at higher risk for infections on these meds, we're not hearing from the rest of the world, from physicians saying that our patients are having severe consequences, right? And, there is this weird moment right now where, physicians are looking at some of the meds that we use for autoimmune conditions to actually treat the consequences of COVID-19, whether that's Plaquenil, when people have like a mild version of the condition, or even using Actemra or tocilizumab, which is a more aggressive medication for RA and giant cell arteritis, where they're actually trying it in patients that have more aggressive lung disease with COVID-19. So understand that it's not as simple as saying infection bad and being on meds is a risky thing, right? Like there's more to this than just that this is a regular infection. What's causing the bad outcomes in that small percentage of people is when their immune system has a overreaction as a response to a significant infection. So as much as you can keep your immune system level and balanced, it's to your benefit.
Isn't that interesting? So they're testing things like the IL inhibitors like Actemra and such to see if that can prevent the worst symptoms of COVID that are caused by your immune system overreacting to it in the lungs or in the...
Absolutely. I mean, and the reason why is when they're looking at what is the trigger that takes someone who's gotten a COVID-19 infection and suddenly escalates them to a much worse consequence, what they're noticing is that there's something called a cytokine storm, where the immune system is suddenly just accelerating very heavily and causing like a huge burst of those kind of cytokines, the immune system just really freaking out. And they don't have a great way to treat that, which is why they're trying some of these other medications, because some of those cytokines that are elevated, we actually see in some of our autoimmune conditions as well. So again, to me, the big thing is balance here. Keep things under control, keep it steady, and be appropriate with the public health guidelines. But I think the concern that I have for our patients are, number one, that on the medication shortage level, it's a challenging one because realistically, outside of physicians who are helping treat these patients, there's nobody else who's really sort of keeping their eye on the ball here, which is that these people have conditions that are benefiting from these medications. And there is such a public outcry to find quote unquote solutions for what's going on right now that it could push things slightly the wrong way.
Yeah, I understand that. That's a really good point of view. Thank you for sharing that. If I could just take a sec, I think you've addressed this generally, but just to walk through the different drug categories, I know we'll still get questions like people say, okay, so I'm on an IL or a B cell inhibitor or whatever.
Yeah.
Is there anything I should know or ask my doctor?
I think the way to think about it is, Plaquenil is in a different category, right?
Yeah.
Like Plaquenil is not an immunosuppressive. Sulfasalazine is really not an immunosuppressive. It's more of an anti-inflammatory. Obviously, NSAIDs are anti-inflammatory meds. Those are anti-inflammatories, not immunosuppressives. Everything else that we're talking about in the autoimmune spectrum, does fall into that immunomodulatory, immunosuppressive category to different degrees. I'm less concerned about, hey, are you on medication X, Y, or Z? I'm more concerned about, is a condition under control? What are your other risk factors? Are we able to minimize any kind of steroids that you're taking? And are you taking the right precautions? And are you just kind of being monitored safely? Are we checking in an appropriate level kind of times? And are we keeping you on track? So I'm not as worried about, hey, are you using medication X? Because theoretically, this might be an issue. Medication Y, that theoretically might be an issue. A lot of things that sometimes might indicate a little bit of risk scientifically when you actually look at what's happening clinically, they don't quite play out in the same way. So to me, I'm looking more at what are the clinical risk factors and what is actually going on with that individual patient.
And when you're asking a patient about those other risk factors, what do you typically ask about?
I mean, there's some obvious ones that your physician should obviously know if they're giving you these kind of medications. Do you have a kidney issue, diabetes, blood pressure, heart disease, lung issues? Those are some really obvious ones off the top of the bat. I think the patients I am probably more concerned about are the folks that are on these meds, but then have those other risk factors as well. Because they're just at baseline at much higher risk, and they're just a little bit more tenuous. And so you just have to watch them a little bit more carefully. But to me, the big ones are, number one, make sure your physician feels comfortable with the medication that you're on. Make sure that you're minimizing any meds that maybe you don't need to be on. And then just making sure you're kind of taking care of your overall health as well.
I know in the case of like multiple sclerosis, there are some medications where they say make sure your absolute lymphocyte count is above 0.8 or 1 before you go and take that next dose. Is there anything like that similar in terms of blood levels in any of these rheumatological conditions?
Not really. I mean, you monitor them, right? And if numbers start dipping down to a level where you're at higher risk for infections, like your total white blood cell count, your absolute neutrophil count, then you start talking about risk of infections that go a little bit higher. Our patients very rarely will really dip down to anything close to those levels. Realistically, if you have a normal white blood cell count level and it's suddenly dipping with medication, you may need to adjust that medication, either dosage or medication that you're using. But I think as long as your numbers are generally in the normal range and as long as your physician is comfortable with them, I would just continue to follow them as you are.
Okay. When should patients come in and see a doctor versus when should they just do a over the internet type of Skype interview? How do you think about that?
It's such a fascinating question because right now, like in my clinic, I mean, we've converted every follow-up and new patient essentially to a telehealth visit. The exception being someone who maybe needs an injection or somebody that needs an infusion. Those are the only exceptions. I think have a low threshold to communicate with your physician. Realistically, if your physician knows you pretty well, most of those things can still be handled via telehealth. I think it's challenging because most of us are not quite used to that. Like we're accepting of this kind of mode of communication. And so we're getting to that point where I think we're pretty close to where we're okay to do that for most things in life. But for our medical health, I know we're so used to being right in front of our trusted physician. But I think the big thing that when I think about it with my own clinical team is how do we maintain patient care, client service, so that people really feel like that we are hyper communicating with them so that we're on top of every little detail. I think the telehealth stuff is great because you can very quickly and immediately kind of handle that. I would try to minimize any sort of in-office follow-ups if possible right now, but most of this stuff should be able to handle via telehealth.
In infusion centers, is there anything to look out for about infusion centers? Is it okay to go into them if your doctor says it's okay?
I can tell you what we're doing in our clinic, which is we're just thinning out the schedule, right? Like if you thin out the schedule in terms of who's coming through the office for routine follow-ups, news, we're even rotating sort of staff so they're not having to spend as much time. We've reduced our actual hours in the office to really just Tuesdays and Thursdays now, just to kind of let staff get a break as well. Although we're still working throughout every single day to sort of handle patient issues. I think in an infusion center, smart things to me would be don't fill up the entire room, right? Like maybe thin it out by half. It's going to be a little bit tricky in terms of scheduling and figuring that part out, but I think that's a smart thing to do as well.
Great. Anything else that our members should be thinking about now going through this process?
Yeah, I mean, we'll get through this process, right? Like as a species, we'll get through this. I think we'll learn a lot, certainly clinically and medically. I think for patients, there's a ton to learn here, right? In the sense that you're probably thinking about your condition, your meds in a more proactive way than you ever have. And that's actually a good thing, right? Like we should be thinking about our treatments always assessing, is the risk and the benefit worth it? Is the risk and the benefit worth it? Like always going through that process and sort of coming back to, yep, it makes sense that I'm doing this. I think this is also a great opportunity to really sort of clarify communication with your physicians, other healthcare providers. I think it's time from the physician end that we really elevate our game to make sure that we're able to communicate with patients in ways that are modern and convenient and up to date and offering the best level kind of client service that we can in these kind of troubling times. I think you need to be counting on your physician, and you should be able to get a hold of them right now. Even if things are strained, the nature of how physicians are trained, like we're trained for these kind of things actually. Like we're trained to problem solve and handle really bad situations. And so while this may seem like an overwhelming situation for a lot of people, understand that your physicians should be able to handle this, whether that's handling your questions, handling your issues, handling challenges. Like that's literally what we're here for. So trust the people that are here to help you out.
Dr. Tambar, thank you so much. This has been incredibly helpful. Is it okay if members post questions after listening to this and we follow up with you?
For sure, absolutely.
Thank you so much. Really appreciate it.
My pleasure. Thank you.